Hey future doctors, welcome back to our channel Teddy Gets You. Today we are going to discuss an important topic in ophthalmology, that is endophthalmitis, which is nothing but inflammation inside the eye. Endo means inside, opthal eye, itis inflammation, as simple as that. Okay, so what is the definition here? Endophthalmitis is an inflammation of the inner eye affecting the uveal tissue, retina, and leading to pus in the vitreous, anterior and posterior chambers. Okay, so inflammation is caused because of some organisms. So these organisms are nothing but infectious and non-infectious. Etiology is infectious and non-infectious. So what are these infectious endophthalmitis? First one is, what are the causative organisms? There are bacteria and fungi. Bacteria are gram-positive bacteria like Staph epidermidis, Staph aureus, and Streptococci, Pseudomonas, Pneumococci can also cause this endophthalmitis. Next one, fungi like Aspergillus. Aspergillus is the main reason for causing this fungal keratitis, and Fusarium and Candida. Okay, so what is the mode of infection here? Here the mode of infection is divided into three types. First one is exogenous, endogenous, and secondary infections from nearby structures. These exogenous means outside the eye, like post-surgery, penetrating injury like trauma, or corneal ulcer perforation comes under exogenous. In endogenous, which are due to metastatic, like spread from infection in teeth, sepsis, or endocarditis. And in secondary, they will come from nearby structures, which is very rare but may spread from optical cellulitis and thrombophlebitis. Okay, and now let's come to non-infectious endophthalmitis. Here the causative agents are toxins or chemicals which cause inflammation. So the causes are post-surgery, like chemicals on intraocular pressure or instruments, which leads to toxic anterior segment syndrome, or trauma, lens-induced non-infectious endophthalmitis, and tumor necrosis. So these are the important points that you must remember regarding non-infectious endophthalmitis. And let us discuss some of the incident factors here. Acute bacterial endophthalmitis, which is post-surgery disaster. The incident is approximately 0.1% after intraocular surgery. The source of infection is nothing but patient's own flora. Flora means either eyelids, conjunctiva, etc., which are contaminated by instruments or contaminated instruments, and other types are acute and delayed. Acute is in 1 to 7 days after surgery, which is usually caused by bacteria, and delayed is weeks to months, which is caused by fungal like Aspergillus, Candida, etc. Okay, and what are the symptoms here? As usual, the symptoms can be remembered by red eyes, pain, and vision loss. So there will be redness, severe pain, lacrimation, photophobia, and sudden vision loss. And the signs are, there are 9 signs. So what are they? Red and swollen lids. So they can be caused by chemicals. So you can also see chemosis and circumcorneal congestion, cloudy cornea, wound infections and necrosis, hypophagia, muddy and swollen iris, yellow pupil reflex like pus in vitreous, and vitreous opacities and intraocular pressure. So these are the signs that you can observe in the patient. So what is the treatment that you are going to suggest? Treatment always depends on the causative agent. So you will give antibiotics, which are topical, systematic, and sometimes steroids, etc. And you may also give intravitreal antibodies, because here the vitreous cavity is getting infected and the pus collection is taking place, and the pus collection is also taking place in this vitreous cavity. Okay, so here the treatment plan is hit as soon as possible. H for hospitalization, I for inject antibodies, T for treatment as soon as possible to save the eye, because it is endophthalmitis which is inside the eye and involving the inflammation of many structures like uveal tissue, retina, etc. Okay, so here the first one is antibiotic therapy. Here you will give Here you will suggest intravitreal antibiotics like vancomycin, ceftazimine. An alternative treatment you can give amphotericin plus amikacin. But remember, aminoglycosides are toxic here, and you can also add dextromethasone. Next one is topical intensive antibiotics. Every 30 to 1 hour you will give them, and they contain vancomycin or ceftazolin, which are used for gram-positive organisms, and amikacin and tobramycin can be given for gram-negative organisms. So here the causative organism is very, very important. Third one is systemic antibiotics. You will give them either IV or oral. So ciprofloxacin 200 mg IV twice a day, and you will slowly move to 500 mg oral twice a day for 7 days, or you can give OR vancomycin 1 gram IV twice a day and ceftazidime 2 grams IV in 8 hours. Next one is steroids. Steroids is used to control inflammation. Steroids are majorly used to suppress the immune system of our body. So when to start? After 24 to 48 hours of infection, you can give these steroids, and you can give them as intravitreal, topical, oral, etc. In intravitreal, you will give dexamethasone, and topical you will give prednisolone, and oral you will give prednisolone 16 mg tapered dose. Tapered dose is nothing but you will slowly reduce the doses of the medication to reduce or discontinue it. Okay. Lansoprazole for gastric protection. And the supportive treatment contains cycloplegics, which is nothing but atropine 1% to prevent painful spasms, and you can give anti-glaucoma drugs because here you will see increase in the intraocular pressure. And glaucoma is not only about increase in intraocular pressure, but there are also many things that you will see in glaucoma. I will discuss about it in the next class. And the last option is vitrectomy, which is surgical option. So when are we going to do it? If no improvement in 48 to 72 hours, and the purpose is to remove infected vitreous, toxins and bacteria. So these are the important points that you must remember regarding endophthalmitis. So hope this video helpful. Consider subscribing to the channel. Dedicates you for more interesting videos and more information about MBBS. This is Harshita signing off. Thank you so much.